Hello, Pure Powerhouses. Today, we are so blessed to have with us Dr. Orlando Rojas, Doctor of Dental Surgery and leading advocate of Ethical Bio-Aesthetic Dentistry. I had the fine fortune of meeting Dr. Rojas as last month when my daughter Electra came to live with me permanently after just having had her braces removed, revealing enamel damage. I was devastated because the dentist in South Africa where the orthodontics took place, after taking zero responsibility for it, lamented that her enamel damage, which by the way is very visible, was irreversible. I was absolutely devastated, and I then Claire jumped in and said, I know this incredible holistic biological dentist who might be able to help. He's a great friend of the family, and long story short, she put us in touch. And Dr. Rojas gave me a protocol for restoring the enamel on Electra's teeth. And I learned that Dr. Rojas is not only a brilliant biological dental surgeon, but is also mystically directly in touch with the great master, Saint Germain. As in the Saint Germain series, the I Am book series that I referred you to in our spiritual sessions. If that wasn't enough, we have the South African connection as well. So Dr. Rojas was born in Bogota, Colombia, but he has resided in South Africa since 1990. And while he serves his patients locally, he also serves his patients internationally. So yes, you can consult with him via video. Dr. Rojas is beyond iconic in the biological dental field. During his undergraduate studies, Dr. Rojas explored the use of white fillings on posterior teeth. His research contributed to the introduction of light-cured white fillings at his university and influenced the banning of amalgams for women of childbearing age and children under 7.
During my research, I realized that amalgams were already banned in the Scandinavian countries. And with all these arguments, then I managed to introduce white fillings at the university.
Yeah. Oh, I see. Okay. Okay. Thank you for clarifying that. In any case, you have been rightly called a health hero. So in 1988, Dr. Rojas witnessed a dramatic reversal in his friend's heavy metal toxicity symptoms after removing his amalgam fillings, which profoundly shaped his perspective and commitment to finding the truth in dentistry, the tooth in dentistry. Dr. Rojas's philosophy emphasizes conscious dentistry that integrates physical, mental, and emotional well-being. Dr. Rojas's approach is to identify and eliminate what doesn't belong in the body while replenishing what's missing, allowing the body to heal itself. Dr. Rojas' motto is, I pledge to continue surrendering to God's will. I am grateful for this work and this life. And he says, I am guided from within on what to do. Dr. Rojas has been featured in various international media outlets, is a member of over a dozen of the most prestigious dental surgical associations, and obtained certifications from some of the most illustrious universities in the world, including Harvard and New York University. Without further ado, I welcome Dr. Orlando Rojas. What a gift it is to have you in our midst today. You have certainly been an intrepid visionary, researcher, soldier, spiritual guide, and lifesaver in a time when dentistry has seemed otherwise barbaric. I have so many questions to ask you, but first I want to just establish a theme for this conversation, which I'd like to make making connections. So the theme, making connections, because I believe that we become empowered when we see how things are connected, and the more connections we make, the more connected we become. So welcome, Dr. Rojas.
Thank you very much. Well, that theme is amazing, especially if your audience is aware that everything without exception is connected.
So with that, I'd love to start with the meridians in our teeth, and how is it true that every tooth is connected to a meridian? And I've always believed that we have these canals, these channels that run between our teeth and our gut. Can you speak a little bit about the connection around teeth and the whole of the body?
Yes. If we together as humanity and in the world are interlinked and connected, imagine within the one body. So you cannot say that you are okay if you have an ingrown toenail. And then indeed, the meridians that are well known by many through acupuncture practices or reflexology, there are meridians that run through the teeth, and whatever is linked in the same meridian will be influenced or affected both ways. So you could have, for instance, sinusitis, not knowing it, and then you actually have the symptoms on the tooth and the other way around. So many patients with sinus problems go to the dentist for a tooth problem and there is nothing wrong with the tooth. Or they go to the ear, nose, and throat specialist and the sinuses are okay, but the problem is on the tooth. And while they are specifically linked to a meridian, it doesn't mean that it will only affect the things on the meridian. And the examples that I use the most, because they are the most relevant, is that if there is a root canal treated tooth, meaning a dead tooth in your mouth, there is 98% correlation to cardiovascular disease. So it doesn't have to be a specific tooth. Any tooth can cause that. And also a mind-boggling one is breast cancer, 98% correlation with a root canal treated tooth. And more specifically, the first permanent molars. Yeah.
Wow, that's so interesting. Now, I watched that film, Root Cause, many years ago. And would you say that most of what's in that is correct, is accurate? I believe it was, kind of taken apart and wasn't treated kindly by the medical industry. But what would you say about that?
Well, when I learned about that documentary from Australia, I immediately watched it, and of course, I can relate to that totally, because most of my patients come after having given up on the medical establishment, and then it is invariably mercury fillings, root canal treated teeth, necrosis of the bone. Remember the so-called cavitations that are also mentioned on that video. And in the video is this guy had a punch in his face, and then it was actually the front tooth that lost the vitality, and then he had these horrendous health problems for more than a decade, starting at a very young age. So yes, most patients come not understanding why they are sick, but once we remove these challenges from the mouth, they find miraculous healings in different ways, Having said that, we never, ever, ever guarantee that the symptom or the problem that the patient is dealing with will disappear when we do the so-called dental revision and we do what is required.
When you talk about a dental revision and sort of imagine there's a full evaluation of what could be lingering in the mouth, necrotic tissue and all these things, are you able to say a patient was to come into your office and had mysterious illnesses and just couldn't solve the problem, would you be able to identify anything that could be if it's in the mouth? Like, could you almost do an excavation to determine what that could be?
Yes, it's not difficult. In biological dentistry, from my perspective, the perspective that I use is I need to identify if there are metals in the mouth, and that is very easy, and if there are infections in the mouth. An infection can be any gum disease, and gum disease ranges from mild gingivitis, which is a temporary swelling of the gum. You go on a weekend away and you forgot your floss or your brush or something like that. You might come back home with a little bit of bleeding here and there. But once you go back to your flossing and your brushing normally, that will disappear. But in that moment, when it is inflamed, then there is an opening for trouble. Now, when a gingivitis is not taken care of, then it starts damaging the attachment of the gum around the tooth. So I normally use this example. You know, the gum must be very nice and tight around your tooth. Gingivitis is swelling of the gingiva, and it opens a tiny gap. And once you have this tiny gap, your food can go inside. And if it stays inside, it will cause more inflammation, more irritation, infection, and if not taken care of, it will start destroying the bone. But once it is under the gum and you have bleeding, all these pathogens are in contact with your vascular system. So any bacteria at that level will go all around your body through the bloodstream. And the deeper the problem gets, and a lot of people have heard the term of pockets. Oh, I got pockets, you know. That's more complicated because if you actually put a pen or some tissue in your pocket, you cannot brush it away. You cannot floss it away. You have to get inside the pocket, grab it, take it out. So when somebody has a pocket, it's a constant path of pathogens of all kinds into the system. And the interesting thing is that you don't really need to be a biological dentist because we all learned that at university. So in the early 80s, when I started studying dentistry, I learned that, you know, so that there is a relationship between gum disease and cardiovascular disease. So it's nothing new, but sadly it's not taken into account. They don't put two and two together. You know, they say, oh, you've got gingivitis. Oh, you've got periodontitis, which is a more advanced gum disease, periodontitis. And they will never think about cardiovascular issues. They will just say you need a cleaning, you need root planing, you need surgery, because otherwise you will lose your tooth. And the emphasis remains on your dental health, but without putting it together with the systemic effects of that. So infections again from gingivitis, chronic gingivitis, we understand, and I'm sure you know it very well, that chronic inflammation is causative of several conditions. And then that is one of the infections, gum disease. Now, if there is a dead tooth, you know, or even a cavity, dental decay, dental caries, if you have a little hole in your tooth, you cannot clean that little hole. So it's filled with bacteria. So that is another infection. And how do you treat that? Like any other dentist would do, with a filling, just removing the decay and filling the tooth. Another infection is the teeth, as I mentioned, that have not been treated. And then, like you see in cartoons, one day the character wakes up with a swollen face, and then they put the cloth around the head and they rush to the dentist. And those infections, those abscesses can be acute, as when out of the blue, it happens and it is very painful, so everybody will immediately seek help. But if it is chronic, you don't necessarily have to be aware that you have the abscess, because it's of a very slow growth. Something that is might be of interest to your audience is that very often kids, after the age of 6, in other words, once the permanent teeth break through, and they are playing with their siblings, they're playing in the swimming pool, and they knock a tooth. And you say, oh, nothing happened. Oh, thank goodness, nothing happened. Or maybe the tooth breaks a little bit, the dentist fixes it, and not a problem. 20 years later, that tooth will be darker than the rest. So that means that that tooth was hurt to death in the beginning, but it didn't die in that moment. And very slowly, it dies until it's totally dead, and then it changes color. But it's not painful. It's never painful, okay? And then many patients come, I don't know why I have this tooth that is darker. Well, we know, any dentist would know. So yes, dead teeth. And then the dentist, in front of a dead tooth, will clean and remove the dead nerve and do a root canal. Sometimes it's routine treatment, a normal filling, a normal cap, crown, and the patient has sensitivity afterwards. And different dentists will do different things, but there are those, and sadly, more and more dentists every day will say, okay, you need a root canal treatment because the tooth is sensitive. And those are root canal treatments that don't really need to happen. And it is actually scary that everybody suffers a root canal at some point in their lives. One of the sad things in my profession, and that applies to medicine and I guess to any other profession, is that research and treatment are market-driven, and the market that determines everything is the companies that produce dental materials. So you can understand that if you are a car salesperson, you have targets. If you don't sell 2 cars a month, then you're out of a job. Or if a dealership doesn't sell X number of cars per month, they are not going to do well. So yes, advertise, market, do whatever you need to do to sell cars. But what happens when the company sells instruments and materials to do root canals? Then they sponsor conferences, courses, all sort of things, and they promise young dentists, oh, with this technology, with this technique, with these materials that I'm selling, you can do root canals without problems. Very easy, very affordable. And then obviously, if you are just going for a filling and now you have to pay an additional X amount of dollars for the root canal, it's more profitable for the dentist, the clinic. And most dentists are ethical people, absolutely. And they truly believe that they are doing the right thing by doing the root canal. So and sometimes it's scary. One takes a radiograph, and it's not 1 or 2, but it's like a mouthful of root canals, like 4 in a row, trying to see where the problem is. Oh, I have toothache, and then, oh, root canal here. And after the root canal, I still have pain. Oh, root canal the next tooth. I still have pain. Root canal the next tooth. So they are very damaging. Things have changed. Things have progressed significantly in the field of endodontics, of root canal therapy. But the fact remains that you cannot clean the multitude of canals inside a tooth. So one tooth will have the main canal per root. If it is a molar, it will have 3, 4 roots. So there will be 3, 4 canals, maybe 5, maybe 6 main canals. And with the latest technologies, yes, they can be identified and treated. And very few dentists, by the way, have all the technology required today for a decent root canal treatment. So that would include microscopes and lasers. So, but when you disinfect a canal, even with lasers, even with the latest technology lasers, I was a pioneer on lasers in South Africa. Now you have lasers that fire laterally instead of vertically to clean the lateral canals. But all the laser will clean laterally is maybe 200 microns, and that is very, very small. And the rest of the canal remains contaminated, especially, well, not especially, always, because if the tooth has died, the pulp, which is the combination of your nerves and blood vessels, and then they go necrotic, they go rotten, and they contaminate the entire network of canals. And then you just go and clean in the middle, but you're not cleaning the entire network of canals. So you harvest and maintain, and forever will be fed all these bacteria, and that's why that will cause disease later on. You can have a perfectly done root canal treatment that will not lead to an abscess in the future, that as a matter of fact will clear a pre-existing abscess, okay? But the tooth is dead. Nothing will change the fact that the tooth is dead and there are necrotic tissues inside the roots. And in this creation, whatever is alive physically, when that life ceases to exist, what is supposed to happen? Ashes to ashes and dust to dust. Continue with the recycling of life. So a root canal treatment is an artificial way of preserving something dead, like pharaohs in Egypt, mummified, okay? So the other example is the people who like hunting, and then they cut the head of the poor animal and they put it on the wall, taxidermia, and that's it. We don't keep things that were alive, we don't keep them. Even at some stage, it was very fashionable to decorate houses with baskets full of dead, dry petals of a rose, you know? Beautiful. But then when people come to understand energies and feng shui, that is a big no-no. You need to remove your dead energy from your house and get rid of it. So now you keep dead energy in your mouth. So those teeth, when removed, I've been doing this for over 30 years. Why do I do it today? Because of the healings that take place, you know, the improvements in health by just getting rid of dead teeth. And continue with my list of infections, from gingivitis to cavities, root canals, is actual infections in the jaw bones. And that is the procedure that I do the most, simply because we're only 2 in South Africa doing that procedure. And it is necrosis of the bone, so rotten bone. And again, it's a gray field in dentistry. The father of dentistry, Dr. Black, over 200 years ago, when he wrote the Dentist Bible, okay, he drew how we should drill into a tooth to restore it with an amalgam. He drew all the anatomy. He drew all the pathology that can occur in the mouth. And he drew osteonecrosis lesions, beautifully described, but there were no x-rays to diagnose that. He could see it on cadavers. So you couldn't diagnose them on a patient that is alive. And then eventually x-rays became a reality. And, you know, in the beginning, they were highly, highly carcinogenic. It was huge radiation going everywhere. And decades and decades and decades went by until we got decent x-ray equipment. But now, the professors teaching in universities for over a century, they never saw that on a patient because they didn't have the equipment to diagnose it. So now that the equipment is there, they are not teaching it. They forgot about that, okay? And yes, so we learn about all sort of pathology in the bone, but we don't talk about osteonecrosis. And well, every single time I open a jawbone where it deserves to be open, because there are merits to diagnose it and to the intervention, we find a lot of infection inside the bone, a lot of infection. And these infections contain not only bacteria and fungi, but they contain parasites. So like in the last 2 years, we have introduced antiparasiticals in the protocol. Even ivermectin, that was the savior for 4 years ago, okay? And it is very important to clean these areas of rotten bone.
Wow, Dr. Ross, that's so informative. I just could listen to you speak about this endlessly, because we need to completely revise everything we know about our dental care from even obviously before we're born. It's extraordinary. Okay, so this necrosis in the jawbone, would you say that that's probably systemic, or is it more limited to the jawbone?
Well, while you can have osteonecrosis in any bone by definition, there are specific factors that will attack the jawbone. One of the nicknames for the lower jaw is the dumping ground of toxic waste. So when we have not been aware of our diets, when we've been eating processed food and all the preservatives and all the chemicals, canned food, all the rubbish that is out there in any supermarket. So all this chemistry needs to go somewhere. And one of the sites of predilection is the lower jaw. But the main reason for osteonecrosis of the jaw is the extraction of a tooth. And especially so, the wisdom teeth. So it is more common at the back and less common to the front, but I have found them everywhere.
So the removal of teeth, which most of us are told is essential, is not advisable.
Well, if they need to be removed, they need to be removed, okay? So not everybody should remove them. One of the mistakes I made when I was a newly qualified dentist was to ask my very good friend to remove the upper wisdom teeth for me. And I've been missing them ever since. And then, of course, eventually, it developed into a cavitation, into necrosis of the bone, and I have to have them cleaned. The main reason being, the ligament that binds the tooth to the bone, the periodontal ligament, normally stays behind after any extraction. And what is the function of any ligament? Ligare, to bind, to join, okay? So if you don't have a tooth, now the ligament that remain in the bone is now unemployed, and we know the problems of unemployment. There will always be trouble. So some ligament will come attached to the roots, some ligament will stay behind. So any healthy body will be equipped to deal with a ligament that stays behind, okay? But sadly, you and I, and our parents perhaps, left the rural areas a long time ago, when we were thriving in nature, walking barefoot and having organic food all the time. Everything was organic back then, okay? So the immunity was excellent to deal with whatever used to come our way. But now in the cities, tennis shoes and lousy diets, so we cannot really respond to that. Now, let's also bear in mind the age of eruption of a wisdom tooth. They are developing in the early teens, and they start erupting depending 16, 17, 18, early 20s. And what was your concept or my concept of health when we were 14, 15, 19, 21, 22? Number one, not a concept. We didn't care. We didn't care. Our parents, God bless them all, they didn't know enough. It was just life as usual. Go and work and that's it. So going to bed late, you know that the best thing for health is to restore your circadian rhythm, to rest. But when you're a teenager, the last thing you want to do is to go to bed early. And we eat all the junk that is available because we all love chocolates, we all love biscuit, cookies, however you call them, and all the nice things, okay? So we are not feeding, we're not nourishing the body accordingly. Hence, you're doing an amazing job. So, and then the other thing is we are growing up. In our teens, we are getting as tall as we will ever be. And the physiology of the body is geared towards growth and development and becoming the young men and women that we will become. And then the tooth was extracted. At university, they didn't teach us to, and they don't do it today, to remove the periodontal ligament after taking out the tooth. So it remains behind, and those that remain behind go rotten. So they cause microscopic infection because every ligament fiber is a tiny, weeny little microscopic thing, but there are millions of them. And then the one infection merges with the next and the next and the next, and then you end up with a massive infection. Totally ignored by my profession. And I have had conversations with friends, amazing surgeons, amazing maxillofacial surgeons, amazing oral surgeons, and they disregard and they would not entertain for a moment the possibility that a cavitation is actually a thing. And it will always go unnoticed. Nobody will ever diagnose them unless you go to the right place. So the other thing, again, with cavitations, with osteonecrosis, is that it grows very slow and it is another chronic infection. So it will not give pain. It is reckoned that about 5% of cases will lead to pain. And when that happens, it's really nasty. It's, people can bang their heads against a wall, It is, when they go to somebody clever, they will say, oh, this is neuralgia of the trigeminal nerve, this big cranial nerve that splits into three nerves to come to the lower jaw, the lower teeth, and that side of the tongue, and then the second branch to the upper teeth, and the third branch towards the eye and the lower side of the eye. So when that happens, it means that the bone has been destroyed to the point that it has damaged the canal that protects the nerve. So the nerve, this nerve is beautifully protected inside this canal. But if the infection has destroyed that canal, it will affect the nerve and cause a lot of trouble. As a matter of fact, the only possible collateral damage on that surgery is injury of the inferior alveolar nerve of the trigeminal nerve. Cleaning the cavitations of the upper jaw in my hands is totally uneventful. Okay, like you can't have complications. Even if the sinus is right there, we clean all the way up to the sinus floor, and we make sure we remove all that infection. But in the lower jaw, it's trickier. And then sometimes if the infection goes to the nerve and around the nerve, I leave it alone because we don't want to cause permanent damage of that nerve. When there is nerve damage, it can last, depending on the severity of the injury. You know? If you just touch the nerve, you can be numb here on the lip. This is a square area on the chin, on the affected side. A couple of days, a couple of weeks, not a problem, okay? But if you actually nick the nerve this much, it will be a few months, or several months, or a couple of years. As long as the nerve is not totally severed, there will always be recovery of the nerve. But all right, that is the only not desirable consequence of this operation if it happens. And yes, but when the bone is clean, what a pleasure. Now your immune system doesn't have to deal with this nasty infection.
Well, this gives totally new meaning to a dental cleaning.
Well, that is not a dental cleaning, that would be a bone cleaning.
No, but it's like, everyone goes in and has, all this scraping and all, the plaque removed and the water power, cleaning the tooth, everything's superficial. But I mean, what you're describing is just, literally so much deeper than that. And the rot and the necrosis, and given the fact that the story you tell of the teenager, for example, is universal, more or less. You're talking about a whole population, billions of people walking around with this kind of filth and rot and death, not only in their mouth, because obviously we're making connections here, as above, so below, and sort of systemic issue of walking around with a lot of death in the body.
Yes, a lot of death tissue in the body, because it is estimated that at least 95% of everybody who has ever had the wisdom teeth taken out will have osteonecrosis, will have cavitations. Like when we remove any tooth, that bone will heal fairly quickly, 3 months. Give it 6 months, okay? Now, if in 6 months the bone has not healed beautifully, it will never, ever, ever heal. Because that means that something else grew instead of bone. So whatever infection was left behind, or whatever infection infected the wound, will grow and occupy the space that was supposed to be occupied by bone. And it will never heal. And then oftentimes people lose some permanent molars early in their lives, and then the other teeth at the back move forward. They get skewed and they move forward and they close the gaps, or with orthodontics, the gaps get closed. And then you trap cavitations between the roots of adjacent teeth. And those procedures are more delicate to do because they are in between teeth. But yes, it is pandemic. It is pandemic. I learned, and I was trained by an amazing mentor here in South Africa, and we did it in a certain way for many years. And then eventually I had the privilege of meeting an incredible biological dentist, one of the inventors of ceramic dental implants. And I went for shadowing on several occasions to his clinic. And then we upgraded and updated the techniques, and the technology to clean these infections in a more efficient and less dangerous way. And he says, one dentist from Seattle State in America was attending this course in Switzerland, and he asked, what if we are doubtful as to whether or not there is a cavitation? And without hesitation, the answer was, it is a cavitation. If you have considered the possibility that it is definitely a cavitation. It is very important today to have a 3-dimensional scan to diagnose it better. I've been doing this since 2005, long before I had my first 3-dimensional scan. And we were diagnosing this condition on the sole basis of an X-ray. And it's incredible how they are easy to miss, because the cortical bone, which is very, very thick bone, the jawbone, okay? You have the side towards the cheek and the side towards your tongue. And in between, you're supposed to have bone. But even after cleaning the entire infection, so I know that there is nothing inside because I already cleaned everything out, but I have the plates on the sides. Then we take a new X-ray. These plates are so thick that you don't see the cavitation, or you don't see the hole in the bone because of the overlapping of this one against the other one. That doesn't let you see anything inside. So that's why it is very important to do a three-dimensional scan to be able to see the cavitations. Yeah, amazing. You know, one of my colleagues working for me in my clinic, no, nonsense. She's a big specialist from Loma Linda University. No, this is nonsense. So she was removing the second molar. The wisdom tooth is the third molar. Okay, the first molar comes out at the age of 6. The second at the age of 12, give or take, and then the wisdom tooth. So for a family friend of hers, she removed the second molar, and she saw there was some infection behind that second molar. So she took a big bear and she went backwards and removed some infection that she actually saw. This patient, the day after, called her, "What did you do to me? I'm full of energy. I feel so vibrant and vital." And she did not do a cavitation cleaning procedure. Just from the socket, the hole left by the other tooth, she went underneath and she cleaned some of the infection, and this guy was feeling so much better already. So now imagine when you actually go into the infected side and you clean that properly. So
that's remarkable. It's like the equivalent of having a colonic. And how good you feel after that. Gosh.
yes.
Okay. So I mean, there's just so much here, from the simple, let's say, the pockets created by gingivitis, which creates something so complex, and then the bone, the jawbone winds up collecting all of this, and the rot accumulates. It just sounds like, I mean, it's devastating. There's so many contributing factors that, you know, where does someone even begin? Because most people have, especially of a certain age, have amalgam fillings, have had teeth removed, have had root canals, have the gingivitis that's become the jawbone rot, and like it just, and the necrotic tissue, and then the ligaments hanging back after the root canal. And where does one begin? And also, I'd love you to speak to how you replace the teeth that then need to be removed, because if you're getting rid of the death, you're replacing it with, is that with the ceramics? And then finally, I'd love to speak about regeneration, because I'd like to know the upside of all of this too.
Well, where do we begin? in this topic, and just for an instant, let me talk about mercury-containing fillings. It is super important to never have a mercury filling removed by a dentist who is not a biological dentist. There are protocols established by the International Association of Oral Medicine and Toxicology on how to remove a mercury filling, okay? And one of the most important things is to provide a source of oxygen to the patient. So it's a whole list, it's a whole protocol. So you cannot just go to the average dentist, "Oh, the tooth broke or I have a cavity," because they will just drill it out and there will be mercury in the entire room for everybody to get toxic. Okay? If one looks at the protocols in hospital, number one, thermometers with mercury were banned in the first world. I cannot even remember, like 2 decades ago. And they dumped all these thermometers in third world countries like South Africa. I remember once I went to a dentist meeting And in the registration desk, they would give in thermometers for free to all the dentists. No, but have more, have 10, have 20. Because if you break one of these thermometers and there is one drop on the floor, in the old days, they would close the hospital wall. They will bring the SWAT team to hunt this mercury. It is very toxic. And yet, many people have them in their mouths and they get drilled out without any consideration whatsoever, because the owner of the patent of modern amalgam is no other than the American Dental Association. So while the market share has dropped, and I'm very outdated in these figures, but once upon a time, it was $8 billion a year. The last time I checked, it had dropped to $6 billion a year. And today, simply because everybody wants white teeth, many dentists stop placing them. If the dentist is older like me, they will still be placing amalgams, okay? But the removal, a lot of people have them in their mouths. The removal is absolutely important. Many people, and I have met in my office, no less than 10 ladies between 28 and 38, that they just went for one mercury filling, or either they got it or it was removed. And the next day they couldn't get out of bed. And they go on full-blown multiple sclerosis and nasty conditions, fibromyalgias and things like that. It's really toxic. It doesn't happen to everybody. Imagine, otherwise everybody would be on a wheelchair today. But it happens, and nobody wants to be the next one experiencing that challenge in life. And then your question was, yes, when you lose a tooth, yeah, clearly the best option would be to replace it with an implant, a dental implant, which is the screw that goes inside the jawbone. And for decades, we have had metal implants, the vast majority of them containing aluminum, but mainly titanium, and about 6 to 7% of aluminum, as you guys call it there, and absolutely no. So, and the other thing is, because I did place, I don't know how many metal implants back in the day, and as a biological dentist, my consideration was, can the patient react to the titanium? And we would do blood tests to determine that. But I completely abolished them from my clinic, because back in the day, we didn't have Wi-Fi, Bluetooth, and 3G, 4G, 5G, and coming soon to a theater near you, 6G and 7G, because every metal in your body is a little antenna attracting electromagnetic frequencies. And from the remote control of your television, of your car, your garage door, these are electromagnetic fields that our bodies were not used to, okay? If I'm with you at a barbecue and I drop my, I don't know, my salad, I'll pick up my lettuce and I'll just dust it off and I will eat it. I don't mind picking up a banana from the floor and eating it. I don't mind at all, because I want to believe that my immunity is good enough to deal with all these bacteria. But our bodies are not ready to deal with chemicals in your food and with electromagnetic frequencies, because they didn't exist when our parents were raising us up. Okay? It's something totally new. And that is making a lot of people sick. So in biological dentistry, we also want to incorporate lifestyle changes.
5G towers with metal in the mouth must be, absolutely.
Yeah, hectic. And, in our profession, all of us guilty as charged. When something doesn't go well, oh my goodness, it's your responsibility, it's your fault. And the typical one on implants, metal implants, when patients start losing bone, so having peri-implantitis, the equivalent of periodontitis, but on an implant. And then, oh, you're not flossing properly, you're not using your water flosser, you're not brushing properly, and then the blame goes to the patient. And the patient says, oh, but I'm brushing. And in the meantime, is the electromagnetic frequencies attracted by the implant causing the bone loss.
Wow.
Yes, it's another
That
long
makes
story.
sense. It makes so much sense. And of course, the bone is holding our mineral stores. So, our blood then needs to maintain its alkalinity. So it's going to grab from the tooth and the bone to do that, depleting our bones and teeth.
Mm.
It's remarkable. I mean, what I do love about this, what you described earlier on, is this aliveness quotient, or this sense of aliveness in the teeth. And I think if we were taught as children that our teeth were alive this way, we probably would treat them very differently. But there's this sense of teeth being just solid and dead. And so if we really think of our teeth as being alive, we want to treat them, I think, a lot better. But in terms of that aliveness, we have the potential for regeneration. So in terms of regrowing enamel, in terms of the body healing itself, if we give it the conditions to do so, if we stop doing the toxic things, if we go to a biological dentist and properly have the metal removed, if we start to line all that up, we start to do things correctly and initiate or create the conditions for healing. What is the possibility? What have you seen, and what do you know for the mouth to be capable of in terms of regeneration?
That's a scary topic. But let me take it from where you started. You cannot really teach your children nothing that you don't know. And knowing is acting, is being. Is not go and brush your teeth. Dentists show him or her how to brush and how to take care of that. That is not teaching, and that is not learning. We theoretically know so many things that we have not implemented in our lives, so we don't know them. You only know what you embody. Metaphysically, you know that is absolutely correct, your intention and what you give out. So having said that example, and I always tell everybody that we should take care of our teeth like we take care of our children, our babies. You remember how you would clean Electra's body when she messed up her nappies. You made 100% sure that not a speck of dirt was left between her beautiful folds. And you clean them with love. It is love what causes the right effect. So same thing. I want to comb my hair, I want to do it this way or the other way, or a spike in the middle. I'll do it with the love of believing that I will look pretty or whatever, and cleaning my teeth. It's not like they say on television, oh, take this sun clock and brush for a minute, or turn it around, brush for 2 minutes. It's not about the time, it's about the intention, the quality of care that you give to yourself. Oh, sorry, doctor, my teeth are dirty because I haven't been to the hygienist in 5 months. Where do you go to have your body washed? Where do you go to have a clean body? You do it yourself. So why should you have to go and pay, I don't know how many dollars, to have somebody cleaning your teeth? So when we shift the paradigm here, and that applies to everything in life, when you change your paradigm here in synchronicity with the heart, then is when you see the regenerations. Because of the dentistry that I have practiced for over 3 decades, I attract wackos like me. And then I have these beautiful patients who come, oh, look, decay here, decay there. Don't drill it. Don't touch my tooth. I just want you to tell me where the problems are, because I am going to regenerate my teeth. I am going to grow my teeth back. I'm going to grow my gums back, okay? And I love it. How do you do it? And everybody has a different recipe. You go to the internet and there are so many different recipes. And dentists on YouTube saying this will happen if you buy my product, okay? So honestly, I have never seen it. When it comes to regrowing teeth, remineralizing is a different story, like we discussed with Electra. It's a different story because there is no cavity, there is no hole on the tooth. But once you have a hole on the tooth, you're not going to build up new dentine and new enamel by itself. Unless, as you can read in the books of the masters of the East, and that they can regrow an arm. I don't walk on water yet. I'm looking forward to that, okay? I don't have a magic wand or a magic violet ray to restore a tooth. So for as long as we are in the dichotomy of life, in the polarity of life, in the yin and yang, so there are things that need to happen. But the answer to your question in short is love. That's it. Because with love in action, you will spend more time making sure there is no plaque here, there is no plaque there. Oh, this gum is a little bit inflamed. Let me give it a loving massage after cleaning it. Let me use some hydrogen peroxide or some colloidal silver or whatever. It's not a quickie. It's not just. Nobody really understands the importance of having a sequence of cleaning when you clean your teeth. How do you clean your teeth? Left, right, upper, lower, inside, outside. And you go back here and you go back there. And you are neglecting several areas in the mouth that never get touched by the toothbrush. And then busy mothers tend to delegate health responsibilities to a toddler. Did you brush your teeth? Go and brush your teeth. Hello? Look, you yourself, I cannot properly brush my teeth to perfection. Grown-ups and with all the techniques and all the information. Now you want a 3, a 4, a 5, a 6, 10, 11, 12, 15-year-old to clean their teeth properly. When, as we already touched, we don't care. Yes, mom, done, promise you, so that they swallow some toxic toothpaste and then they come and blow your nose. You see, I brush. So example, how do you teach? What are you vibrating? What are you doing? Is flossing time and brushing time a family affair? Okay, guys, we finished dinner. Let's go and do all this together. It's lifestyle. It's absolute lifestyle and intention. All the other things, I have seen them failing over and over again. Yesterday, it was beautiful. I welcome a patient. She was my patient from the year 2000 and 2003. Disappeared. I saw her once in 2010. And I saw her yesterday, this beautiful girl, now with kids and all that. And she is a very Christian, beautiful, beautiful woman. And she's got a website, Christian-based website, and she's selling health products, and she's amazing. And then she says to me, why don't we do a scan and then we'll do another scan after a few months and another, and I even said, I will not charge you for the scans. So you come back and we take the scan. Because she says, essential oils have the ability of permeating the membranes, going through the gum and going through the bone, and she wants to see if she can heal her cavitations with essential oils. My approach, as always, oh, please let it be, let it be. But I want to see it. like Saint Thomas, who needed to put their finger inside Jesus's wound. Okay, so I want to see it happening. I have not seen a tooth regrowing. I have not seen a gum growing back. And I have taken so many pictures from the mouths of the patients who say to me, I can do it because I know A, B, C, and D. So sadly, at this moment, from my humble perspective, we still need the dental tools, okay, as horrific as they are, because it is really, really very sad, when you're trying to, especially with your children, if it is your tooth, okay, take it out, lose it if you want to lose your own tooth. But then there is a tiny little problem, and then a year later on a child, it can be a major problem. It can be a major problem, on baby teeth, 6 months is all it takes for a cavity to really go all the way to the nerve. It is insane. It is insane. So by all means, prevention is always the best. But how do you prevent? That's your field. You start with diet. You start with healthy habits. And you start with sound hygiene practices. In the same way that you have to do the shoelaces of your beautiful child, you have to brush the teeth of your beautiful child. And then, okay, the moment the first baby molars break through from the age of 2, then they must be introduced to the routine of flossing. Again, flossing. All of my life, you should only floss the teeth that you want to keep when you're 60, okay, when you grow old. If you don't want to keep any tooth, so you don't floss that one. But more and more dentists are advising against flossing. Do not floss. Why is that so? It's not because it's not a good thing to do. It's because most people don't know how to do it. So if you just go in between teeth, in and out, you can actually cut and slice your gum. You can cause scar tissue and all sort of things. Or you just think you are flossing, and you're not flossing, and you're not cleaning, and then you still get the cavities. So yes, it is important to have the education and then implement it properly in your routine, in your lifestyle. Today, you don't think about how to do the shoelaces. You don't even have to look at them. So the same in the mouth. And yes, the advice in a nutshell is, and in the United States, praise God, there are so many biological dentists everywhere. Go to a biological dentist. And then you use this usual intuition. Is there resonance between you and the practitioner or not? What is the vibe you get? And if you are totally happy, so be it. And trust that they will do the best possible job, because then those guys will never suggest a root canal. If they are a true biological dentist, they will not offer a root canal treatment as a possibility. You can bring the SWAT team here. You will not find root canal materials or instruments in my clinic. So when there is an emergency or something, so in my hands, the only thing I can do to help you is to extract the tooth. Otherwise, go to any clinic next door and get a root canal in the meantime or something. And I always give my patients the option of the root canal, because I will not dictate, you have to do this and that. These are your options. These are the ones that I can help you with. These ones I cannot help you with, and you have to go elsewhere.
Wow. Gosh, I mean, you've shared so much with us today, Dr. Rojas. I know that you have an appointment after this with your yoga mat, so I don't want to keep you from that. But I do think we are going to have to do a part 2 because there's still so much I want to ask you, and about braces, about the connection between our jaw and our pelvis, which I think there's a distinct connection there with childbirth, and how we've morphed in our in the modern world, like Weston Price, all that history and story. So many things still to discuss, but you have opened a door and given us so much knowledge today, and knowledge that we must embody. And that I know everyone who has listened is going to listen to you speak about this in the recording and in the audience is going to be inspired to make the adjustments required and fall in love with their teeth and care for them like they would their little babies, because that's a beautiful message and image to carry with us.
Yes, while we couldn't even touch on the other aspects, as you have heard already, we are not the body and we are not even the mind, okay? And then we focus so much on the body that we neglect what is important in life. And there is a passage in the Bible that says, "Seek first the kingdom of heaven, and the rest shall be added unto you." So that applies to everything. That applies to everything. Because remember that we have to experience what we have to experience. End of the story. We chose to be born to experience life in exactly the way that it is playing out. Okay, so yes, we have the power of guiding it for it to be more graceful. But when you realize that it's not the biological dentist who will sort you out, it's not the gynecology who will sort you out, it's not money that will sort you out, but is what you exude, is what you are, that everything falls into place. Now, in healing, the first thing that needs to be asked to the patient, what are you prepared to give up in order to heal? Are you ready to give up everything that led to this situation? Because if they are not prepared to give up all these things, that will recur and reoccur and reoccur over and over again. It's like marriages. First husband, 10th husband, 11th husband, but you are not addressing what is important. So it's always important to have that link. And then the hip falls into place, the TMJ falls into place, everything falls into place. So if we want to change the consciousness of diet, it's not, hey, follow my program, A, B, C, and D, because it's not the same diet for everyone, as you know. So we are all individuals that require certain experiences. And it doesn't matter how much you will try to avoid them. If you have to experience it, you will experience it. At the same time, if you're not supposed to experience it, it doesn't matter what you do to experience it, you will not experience it. You can attempt to fake it a little bit, but it's not the experience. It's not the experience. And I'm saying this because if we don't increase consciousness of humanity, doom, and what is going to happen? We need to be committed through us, through the self, the big S of myself, the big capital S, so that from me, everything can change. Your children's behavior, because they see you doing what you do. They don't do what you say, they do what you do. And then that expands in your little community, in your bigger community, in your online community, in your country, in the world. But it is time to be serious about being what we are, being love, expressing love, no matter what. I love Dr. Fauci. I adore the guy. I adore Bill Gates. I didn't before. But without us loving them, how can we go any further? It's not possible. So the work that we have to do within is the most important work that we have to deal with.
Yeah, that's pure wisdom, and get our frequency into harmony with the highest, and then life changes, and the knock-on effect, of course, is in the collective. No, it's beautiful.
It ripples. It always ripples. Whatever you do, it ripples. It ripples.
Right, that's right. Whatever it is, either way. True. Oh gosh, Dr. Rojas, thank you so much for your time today. And I do hope we can do a part 2, because I think there's going to be so many questions that flood in from the community once they hear you speak on this subject.
Thank you very much. It's been a privilege to be with all of you. Blessings to all.
Thank you.
Thank you.
All right, that was amazing. Oh gosh, you covered so much, and again, there's still so much, but I don't want you to be late. You have 5 minutes to get on your yoga mat.
Yes, I'll try the meeting. I'll leave here. Thank you.